Hello, everyone. Welcome to the Physio Almanac, where we help you to learn how to clear your APC exams. So, today we will be talking about the musculoskeletal assessment and part one specifically, that is the hypothesis. So, what I have tried to do is I have split the musculoskeletal assessment into three components. The first one is your part one, which we are going to be talking about today, the hypothesis. The next recording that you can view is going to be your subjective assessment, followed by the objective assessment. So let's talk about what exactly is hypothesis or why we are doing it. And this well applies for all the cases that you would be giving your exams for, that is MSK, neurology, and cardiorespiratory. So before you go and see the patient in their room, you would be given a case file. Now, this case file can be one-page document, especially in MSK cases, or it may be a referral letter from the GP, or it may be a hospital record with lots and lots of information for you to read. So, this information is what you would have, what you are expected to present to the examiners before you go and see the patient. All right, so I'll tell you how it goes again. We will get into the room, the APC lab. We would have our assessors. Before we get to meet the assessors, we would be given a case file. In that case file, we would have information about our patient. This information should be used by you to present a hypothesis to the assessors when they come and see you. After you present the hypothesis, then you go and meet the patient. All right, let's talk about what exactly a hypothesis is. So, according to the Cambridge Dictionary, it says an idea or explanation for something that is based on known facts but has not yet been proved. So, we have, as I said, we have information available and we create an image, we create an assumption of the patient about what we are expecting. And this assumption, this image is what we explain to the assessors. And once we get inside, meet the patient, get into their room, talk to them, do some tests, then we find out whether our assumptions, that is the hypothesis, was true or not. All right. Now, this hypothesis has to be presented in the ISBAR format. So, this is the recommended guidelines, and this is personally what I did. So, ISBAR, if you split it down, as you can see on the screen, it is identification, situation, background, assessment, and recommendation. So, this is what ISBAR stands for. Now, let's talk about these in detail. The first one is identification. So, wherein you would have information about the patient's name, their age, their gender. So, this is what the identification looks like. So, you can say, "Good morning, assessors. My name is XYZ. My patient for today is a 67-year-old female whose name is ABC. And again, she has come to our department," and we'll go on from there. So I'll keep on talking to you about it and then we'll do a detailed hypothesis presentation in the end. But just to give you a brief idea, this is what is required in when we are talking about identification. The next thing is the situation. So we would say, what happened? So now this information may be given in your file, that you would have information that the patient tripped while walking on the outdoor surface of his house or outdoor area, or he developed an ACL injury or got an ACL rupture while he was playing basketball, anything, or there may be nothing given. What we need to understand is what happened, what led to the patient coming to see you in the first place. Now, when I say that, I mean whether the patient has come to see you directly in your clinic, in your physiotherapy clinic, or the patient went to the GP and then he has been referred, or the patient was in so much of pain and trouble that he had to go to the emergency department, and from there he has been referred after discharge. So it can be any of those things. But we need to understand what exactly happened, what led to the injury. All right. So, as I said, why is the patient admitted? So, you may be seeing a patient in the acute ward wherein the patient has just had a knee replacement, let's say, or a total hip replacement, and then we are going to see the patient. So that can also be a patient case wherein you are seeing the patient as an inpatient. So in MSK, we do not only get OPD cases, we also get inpatient scenarios. So we also need to understand what course of events led to the situation of hospital admission. So what happened? and and when we are talking about what happened, we need to understand in detail whether the patient had this injury while playing football or basketball, or the patient was having some pain, and when I'm talking about football, basketball, I'm thinking about acute injuries. So let's say ACL tear, let's say meniscal injury, things like that. Or the patient was having pain for the past 1 year or so, and then the pain became so excruciating that he had to come to the emergency department, and then they found out that okay, there's a cyst, or there's severe progression of his arthritis and he needs to be operated on. Whatever the case may be, we need to understand what has happened, a bit about why the patient is here. All right, I hope I'm making sense. Then moving on, the next thing we need to understand is, are there any other treatments or professionals that have been involved in patient's care? So has the patient seen anyone before? And again, please remember, we are looking at the patient file. So all this information may be there or may not be there. But our responsibility is to present the information that we have to the assessors. All right. And information that you are missing, which is not given and you want to present, keep that with you. And when we do the subjective assessment, we will ask the patient. All right. So let's finish the background component and then I'll quickly tell you how we would say that. Moving on to the background, we would say that the patient's again, we would have to mention about the patient's past medical history or the patient's previous similar episodes. Let's say the patient has had an ACL injury or a hamstring tear before, and it was a couple of years ago. He did not get proper rehabilitation, and then he's got it again, something of that sort. Relevant personal history. So we would like to know whether the patient is a smoker, whether he drinks alcohol, um, and any other relevant personal history that you may need. We would also like to understand about the patient's social history. So we would like to know that whom does the patient live with, or how is the house set up that the patient lives in? What is the occupation? Is the patient a student or he's working? So when we are talking about a student or the working, we are thinking about whether the patient has enough leaves to cover while has he has to take leave, so because should recover, he's able to recover from his injury. So things like that, that we would have to consider. And so understanding all this information which is given in the file before you go and see the patient, you are trying to, as I said, you're trying to develop a picture of what the patient may look like, what are the patient's probable concerns, so that we are able to help the patient and give him the best treatment and advice as needed. All right, so if we have to say that, so let's say we are, our case for today is a 19-year-old female with a patellar dislocation, and she got it while she was playing football, let's say. So I would say something like that. Good morning, assessors. My name is XYZ. My patient for today is 19-year-old female whose name is ABC. She has presented to our clinic today after 6 weeks of 6 weeks post patellar dislocation, which was treated conservatively. We know from the patient's file that the patient has had this injury for the first time, and after she got the injury, she went to the emergency department where she was put on a knee brace and was told to do the exercises. However, looks like from the patient's records and from the GP referral letter that the patient has not been doing any exercises and now is having a lot of difficulty and apprehension to walk and even play. So that's what we are going to be looking at today. And in terms of the patient's personal history, we know that the patient is a smoker, and I'm not sure about the smoking history. I will clarify this with the patient today. We also know that the patient is a student and lives by herself. So that is an area of concern because I would like to understand how is the patient managing her daily activities and since she's had the injury and whether she is able to get any support from her parents or friends. Um, yes, so this is how we would be talking about for the introductory part. Now let's move on to the A and the R, which talks about your assessment and recommendation. So now, again, let's go back to the patellar dislocation case. We do not have to tell the assessors everything about what we are going to be doing when we see the patient. Why? Because we do not tell them that we have a fixed recipe in our head or we have a fixed criteria in our head what about assessing a patient. Well, having said that, there are some things that are fixed. For example, in case of a patellar dislocation, the main area of concern is the knee, right? So when we go and see the patient, we would assess the hip of the same knee of the same side. Let's say if it's a left patellar dislocation, so we will make sure to assess the left hip and the left ankle. So again, coming back to that, it's the joint above and below. This area of concern for the patient was the left knee. So the joint above is the hip, the joint below is the knee. So we would have to focus on those two joints as well. All right. Now, what we would tell the assessors is in brief, obviously, what test or assessments that you would do to establish a probable diagnosis. So, in MS case, especially, there may be cases wherein you would have a diagnosis. So, we know that the patient has been discharged from the hospital post patellar dislocation 6 weeks ago. So that's you have the information. The other case could be the patient was walking on an outdoor surface or an outdoor paved area in front of a house and twisted her ankle, and she's a 38-year-old female, let's say. So she was in a lot of pain and she came to the physiotherapy clinic straight on, did not go to the doctor. So that is your main case. So in that case, you would not have any information. You cannot just assume that because she was walking outside, the patient may have had an ankle sprain. You would have to develop a hypothesis. You would have to do some tests to identify and establish what could be the patient's problem, what could be the patient's case or diagnosis. All right. So, what you would say is to the assessors is based on the above information, I would like, and I'm referring to the particular dislocation case. So, based on the above information, I would like to conduct some test. Just say test, do not say special test. So, I would like to perform some test and to find out what are the patient's main concerns and so that we can help the patient today. Or you could say, based on the above information, I would like to assess the patient's range of motion, do some strength assessment, and maybe a walking pattern assessment, and see what are the and understand the patient's main concerns, and then develop a plan to help her. All right. Now, moving on to the recommendations. So, again, now this is the last part of the ISBAR format. All the above information, what you have gathered, what you have, what will you do today? Again, as in the assessment, we do not have to have a strict recipe because we have not yet met the patient. All right. We are just assuming, we are just hoping, and we are just hypothesizing that this is what our treatment option would be for today. All right. So, and you also would, now let's look at the case all over again. So let's talk about another case. Let's talk about 38-year-old female who's had an ankle sprain. All right. So I would say, good morning, assessors. My name is XYZ. My patient for today is ABC, who is a 38-year-old female. We have the information. We do not have a lot of information on her file with us today. It's just one page letter which says that she has come to our physiotherapy clinic um, after she developed ankle sprain. Now, it's not necessary for you to say we do not have a lot of information. It just kind of reflects bad, but if you want to, you can. All right. So what you can say, let's do it again. You can say, good morning, assessors. My name is XYZ. My patient for today is 38-year-old female whose name is ABC. She has been referred to our physiotherapy department after she developed a sudden pain on her left ankle while she was walking. I'm not sure whether she was walking or she was running outside her house. And this happened yesterday. She was in a lot of pain, and today is the first consultation for what she has come to us. So, my plan for today is I would like to understand the patient's main concerns. I would like to understand the patient's medical history, find out what are what are the main concerns that the patient has, whether this has happened before or this is the first time that the patient has had the injury. I would also like to understand what area is involved. So, when we are looking at the ankle, whether it's the outer side of the ankle, whether it's the area of the lateral malleolus and the lateral ligaments, or the medial malleolus and the medial ligaments. Because this is the initial consult, I would also like to do a baseline assessment just to make sure that there are no underlying fractures that may need an urgent x-ray or may need a urgent emergency department visit. And based on my assessment and the patient's goals, I will plan a treatment so that we can help the patient for today's session. That's my plan. So this is also one of the things that you can say. Now, if you have noticed, I did talk about the fracture, right? So, very importantly, if the patient is coming to you directly, if the patient has not seen any other health professional, it's your responsibility to make sure that you have screened the patient well. So that means you have screened for red flags. That means you have screened that there is no fracture that needs immediate attention. And we might be like I am thinking about Ottawa rules when I'm talking about the assessment. So whether the ankle rules or the knee rules that are there, they can be cases wherein the patient was having a fracture and you have just assessed and treated the patient as an ankle sprain and you do not pass. So keep that in mind. Make sure your assessment is thorough so that your treatment is perfect. All right. Now, again, as I said, this was the first part. This is the hypothesis wherein we were talking about the ISBAR format. So, identification, situation, background, assessment, and recommendations. You do not have to tell everything that you will do when you see the patient today. You have to keep it brief and simple. But make sure to include all the information that you have from the patient's file today. And remember, you can make notes. So you would be given some sheets of paper, you would be given a pen, and you can just make notes for you to refer when you are presenting the hypothesis. My advice is to talk to the assessors and not read the hypothesis. So let's say you've got this case file and you are you have this information that you know that you're going to present when the assessors come to see you, and you've jotted down on a piece of paper, right? What you're doing is your head is down and you're just looking at the paper instead of looking at the assessors. So that's not something that I would recommend. It's You have to understand that when you're going to the exams, you are a physiotherapist. You know your stuff. What you are doing is you are talking to the assessors who are your co-workers, who are your colleagues, and you are just telling them that this is your plan for today for seeing this patient. Your confidence during the assessment and obviously the hypothesis presentation will obviously be the first step wherein the assessors will develop an image of you. So make sure you do that first step really well. All right. So I have always believed that your hypothesis is a very, very important component of your exams. So make sure to practice this first and well. All right. Follow for the subjective assessment, which would be uploaded for you very soon. And I'm always available via comments. I'll leave my email there if you need any uh, questions to be answered or if you need any help. Always here for you. All right. That is all from the Physio Almanac today. Enjoy the rest of your day. Thank you.